Assalamu alaikum. Good morning. Welcome to the world of information through DXN, a platform that can not only help you to have some information about your awareness about health and how to prevent diseases and how to improve your quality of life also. Today the topic that we are going to share is a very serious issue of this century. Not only for a generation, it is generations to come. The generation before, the generation ahead is going to be a sufferer of this problem. And so why not have prevention, and better than to think of cure later on. Obesity or being overweight is something which is so common now that more than 1 trillion Americans today are said to be either overweight or obese. And in your house also, in everybody's house, you can see one or the other family members heading either towards overweight or obesity. What we have to offer from our platform of DXN is a wonder product which is known as Myco Veggie. Myco Veggie, as the word myco is very much suggestive of mushrooms, and veggie means a collection of very fruitful effects of vegetables to make you a good meal. A meal that is finally a best meal, a meal that can not only give you strength but also will help you to prevent diseases and also to get rid of your extra fat on your body. Let's see what is obesity or being overweight is. In 1997, the International Obesity Task Force 10, made by WHO, recommended that a standard classification of body mass index or adult overweight and obesity, and that defined as a BMI of 25 to 29 kg per meter square being overweight, and a BMI of 30 kg per meter square or more is defined as obesity. Now, what do you think BMI is? BMI is nothing, just a ratio between height and your weight in meters in kg, and that ratio is definitely different for everybody according to his or her height. Just to have a rough idea for your own self, instead of calculating, if your height is in centimeters 152, whatever is your height, just minus 100, the remaining value is added 5 plus or minus is your approximate weight should be a healthy kg as per the requirement of WHO fitness criteria. For example, if you are 162 centimeter in height, your ideal weight should be something like 62 to 68 kg. Beyond that, you have to be very careful, and once it crosses your 75, definitely you need to be, you are at a higher risk of a lot of diseases. Presently, there is no definite clinical definition of obesity on the degree of excess body fat that places an individual to increased risk of diseases, increased risk of uncontrolled conditions of previous diseases that the person has, for example, blood pressure, diabetes. If they are in a body which is already of high body mass index, the risks are double. General consensus exists for an indirect measure of body fatness called to be the weight for height index or BMI. is definitely in terms of waist circumference and in terms of arm circumference ratio. If you go to a doctor or nutritionist that can measure your BMI and give you the correct value and the need for the approximate appropriate weight for you. It's been historically more than thousands of years ago. If you see the good old temples and the treasures of the past, they do have sculptures showing obese people, and definitely this is not a new thing to know in this era also. The 1.7 billion all over the world, there are people who are going towards obesity. And if you consider American consensus, in 2006 only 4 states had healthcare services, and that has shown a large increase in the population of being overweight and obesity. Almost 32% has increased in America in male population who are obese, and 34.7% increase in female obesity. That is total more than 30% increase in last 10 years in normal weight in the people who are now obese or overweight. In the Western world, where their health care is taken care by the government, that's quite a big issue, because the healthcare cost is more than $100 million a year. In approximately last 10 years, America, England, and all the Western world are spending a lot of their amount on healthcare issues, which is definitely a responsibility of the government. Now, if you see the current state and current rates of obesity, and if you don't check them and you don't take care of that in an early stage, the current generation of young children will be the first in the next 2 centuries who have a shorter lifespan, God forbid, and their not only the expectancy of life, but also the quality of life is going to decline with lots of problems ahead. So we need to have simple behavioral targets to focus, and we need to change our environments to make these behaviors easy. We have to have some ideas to improve local environments, and the lack of that environmental change definitely will have a disadvantage on the community awareness, leading to disparities. Now, if you see nowadays, a chubby baby is taken to be a healthy baby. That's not true. A baby which is having a higher weight as expected according to the height and age, definitely if overweight has got a side effect on his growth, on his metabolic rate, and definitely the growth potentials are different as compared to a healthy profile. And the trends among the adults since 1991 till 2005, 1/3 population of the world is heading towards being overweight at any age, given age group. In the past 20 years, there has been a drastic increase in obesity in all over the world, and especially if we are taking a record of United States of America. And 22-fold increase in 6 years of time has been noted. So this is a dangerous situation. So let's see what causes obesity. The nutrient and the energy model of obesity depends upon 3 factors: metabolism, appetite regulation, and energy expenditure. Apart from nutrition and energy, there are other factors which are making a great effect on the body metabolism itself. First of all, we cannot choose our parents, so we are stuck with whatever genes are given to us. Then behavior and cultural factors, which are a dilemma in certain situations where you are stuck with the type of food, the cultural backgrounds, and also the lifestyle changes which lead to either being overweight or definitely obesity. So the great contributors to weight gain becomes the socioeconomic status also. And if you want to have your own lifestyle set up, cessation of smoking sometime also give rise to a little rise in weight. So other factors includes the hormonal effects, the inactivity of the individual or immobilization or sedentary lifestyle, and psychosocial or emotional background. Plus, there are certain medicines which are responsible for the gain weight. Lifestyle patterns are influenced by overabundance of energy-dense foods and decreased opportunities to, and definitely lack of motivation for physical activity, and medically loss of low hormonal effect on your body or loss of some ovarian function results into the decreased metabolic rate, which definitely is a reason for accumulation of extra fat into your body. So obesity results from increased intake of energy, one, or decreased expenditure of energy. So there should be a balance, intake and output balance, which is required as per the first law of dynamics, thermodynamics. So whatever you have taken as a part of energy, if you don't use it, it gets stuck up as a adipose tissue. And it is so hard to lose it. Medically, if you go into the background, it's a lot to say, and time doesn't permit me to go to the biophysics and pathophysiologies of metabolic causes for obesity. But just the external factors that we can discuss are the emotions, the characteristic of food that we have chosen to eat, and the lifestyle behaviors and environmental setting or cultural backgrounds. That promotes the higher intake of calories, resulting into misuse of your food, and definitely if you don't utilize that energy, it gets deposited as adipose tissue. There is another hormone known as leptin, which is responsible, and it has been already very well abundantly written and explained as a basic scientific effect in the causes of obesity. Without going into the details of what causes obesity and what not causes obesity, let's see what happens once you get obese or overweight and what are the complications of this. Starting from head to toe, if the waist circumference measurements are more than 40 inches, that is 102 centimeters in men, and 35 inches, that is 89 centimeters in women of an average height and weight, it also indicates an increased risk of obesity related comorbidities. So what are these? Let's see, from up to down: stroke, cataracts, coronary heart disease, diabetes, dyslipidemias, hypertension itself, severe pancreatitis, pulmonary diseases, fatty liver, gallbladder disease, then gynecological abnormalities, what to say of infertility and reproductive illness, abnormal irregular cycles, polycystic ovaries, part and parcel of obesity. So if you start measuring the lesions, it will take a lot of time just to take it as a subject of obesity. It was general. Now see what happens to the bones if you bombard this bony structure by a high adipose tissue or high weight in content of weight. Arthritis, gout, and all these things will have the quality of life will decline, dependence on drugs will increase, and also it will have a disastrous end life, which will be either dependent on drugs, doctors, and maybe old houses, because it's very difficult to take care of obese patients when they are old and having aging problems also. It has been noted and quoted that among the people who are having type 2 diabetes, the high BMI or overweight people have 30 to 55% high risk of obesity, of diabetes, as compared to low BMI or low weight group. Normally, every person has got a tendency, if the lifestyle and genetics background of diabetes are there. So 15% risk is always there, even with low BMI of as less as 25 only. But with BMI over 25 till 30, there is a risk of 30% risk of having type 2 diabetes. BMI over 30, 55% chance of an individual percentage is liable to have a diabetes mellitus. So you can see why I am stressing on going for a management pre-obesity or about to get fat tendency in the individuals who have a family background of either diabetes mellitus, obesity itself, or other before mentioned diseases or the metabolic syndromes. So according to Hippocrates, sudden death is more common in those who are naturally fat than in lean. So you are, even if you don't have any disease, a reason for having a sudden death is more liable to have if you are having a high BMI. How to treat? First, to focus yourself. First, to decide what are you looking for. Are we there? Are we heading for something which we know is not okay for us? A condition which is knowingly we are going to fight back later on with drugs and hospitals and long-term lifestyle problems. Or you assess the comorbidities and how much lab investigations you would need to go for the reasoning of obesity, how much diet changes you need to go for appropriate diet calculation every day. Are we ready to get motivated enough to lose weight and not to gain weight also? Because see, the two people are at risk. One, who have a tendency but they are not overweight right now, and two, who are already overweight and obese. So let's set up a physical activity goal also, apart from your diet management. So weight loss strategies definitely have diet therapy, first of its kind. Then increase physical activity. Sometimes some drugs are needed because there are certain metabolic disorders which are responsible for your gain in weight, and behavioral therapy. Some surgeries if you want to cut the time period short, and any of the combination of the above mentioned can be taken into account. Behavioral targets would be that to have frequent small meals, 5 fruits, vegetables per day. Screen time limitation. You will be thinking, what am I talking about? What do you mean by screen time? I'm sitting in front of a screen? Yes. This is the time which you are doing nothing, just watching television or sitting on a computer for hours. It decreases not only your physical activity, but also it slows down your metabolism. And according to statistics and according to the studies, if you want to keep yourself and your kids healthy, 5-2 or 5-2-1-0 calm down therapy of your diet should be taken. That is, what is 5? Eat small 5 servings in a day, which should be of fruit and vegetables. What is 2? Limit screen time to 2 hours. What is 1? Participate in at least 1 or more physical activity every day. And then 0 means avoid sugar, sweeteners and sodas, and limit fruit juices to half a cup or less in a day. Instead, try to take more of fluid and try to take more of water. 3 to 4 servings in a day, a minimum. If you take it in glasses, 8 to 12 glasses of water should be taken a day. First simple target is to avoid soda and sugar added beverages. And second is to limit screen time to not more than 2 hours. The hypothesized impact of television viewing on obesity is you keep on watching television, you're sitting in front of the television eating and sleeping there, not mobilizing itself. And then whatever you take, you are not thinking, you're not eating fruitfully, a process of having a food, enjoying a food, and then utilizing a food are the 3 different roles of food that we need to think about. And if you sit and eat and then sleep there only, it converts into a normal person, into an obese person. Because of inactivity, because of inadequate intake, and because of low metabolic rate, you are heading for a disastrous increase in weight. There are 4 randomized controlled trials already done which say that there is impact of television viewing on the weight also. So if you want, you can go on the internet and find them out. There is expertise in nutrition who are thinking a lot for limitation of screen time for kids, because people are taking a shortcut, taking every information instead of physical activities. They are sitting in front of television or computers. So therefore, the third target would be to participate into physical activities at least 1 hour or less per day. A realistic goal to follow would be to have at least 5 to 15% of from a baseline, a loss of 5 to 15% in 6 months of the treatment. Weight should be lost at not more than a kg or 1 to 2 pounds per week, based on the caloric deficit between 500 to 1000 kilocalories a day. Dieting is highly ineffective. I don't think dieting is the answer to lose weight. 95% people fail. They lose weight when they diet and then they come back to the same state when they leave it. So the principles of dieting should be to have 1200 kilocalories as per the circumstances and the lifestyle of the person itself. Women should consume at least 1200 kilocalories per day. Men should consume about 1500 kilocalories per day. They should have selection of diet which has 75 grams per day of proteins, that is 15% of their total calories should be of proteins only, and more than 55% of total calories should come from the of carbs. And fat should be less than 30%, because if you are heading for reduction in fat, so avoiding fat totally would be beneficial, or good quality fat in a minimum amount is mandatory. And above all, high fiber diet with 20 to 30 grams per day with fruits and vegetables. And supplement the diet with the vitamins and minerals and avoid sugar. So if you look back into the amount and the cost of whatever I've told you, there is a rough idea that what Weight Watchers spend in terms of dollars, minimum $13 to $15 only the registration into a nutrition clinic a day, and consultation between $200 to $500 per week. And if you join a club, at least $20 to $40 a week. And if you join a system or nutritional course, it may be not less than $50 to $80 a week. Or if you go for Atkins diet, again it is very expensive because you need a good quality protein diet only. So you end up in a hole in your pocket, or if you add medications, it will be a lot more. So what do we have with us? There should be some solution. Apart from surgery, there should be some solution apart from medication, and there should be a solution apart from less physical activity. And the answer is micro-veggie. A diet that ends all diets and a meal that will end all meals. It's a complete food, it's a complete meal. And it has as ingredients the famous spirulina, noni leaf, lion's mane, psyllium grain, which is very common nowadays. Every second house or every house has this used for constipation and diarrhea. Celery, mulberry leaves, ginkgo biloba leaf, and ginger, lemongrass, 5 types of mushroom including shiitake and Liphidium and St. George's mushroom, oyster mushrooms, grey split and elm oyster, sweet corn, lime and orange, green tea and pericarpium, star anise, clove, cinnamon. All these 23 contents of micro-veggie make it a tremendous food supplement, which not only takes care of what is happening into your body, but also gives you a little bit of shortcut and little relaxation to decide what we have to eat and what not we have to eat. How to take micro-veggie is about 1 gram, 1 scoop, and you can add cold or warm water, quickly drink it, stir well before it gets swollen. Because it has psyllium, it gets expanded and it absorbs all the water, and just like kheer or just like a thick paste, it will be difficult to swallow. So there are a lot of recipes I will tell you later in the talk how to take micro-veggie and make your life very quality life and add it as a part of your food. Having said the content of the micro-veggie, the individual herb which is inside it has its own implementation and has its own good effects on the body, but in totality, the nutritional fact with 1 scoop, if you see as a content, the energy given in 5 grams is only 18 kilocalories, and total carbohydrate is only 4.3 grams in 5 grams. There's no sugar, protein is 0.1 gram, no cholesterol, and the fiber is 3 gram, plus sodium is 4.3 gram. So if you take 100 gram of micro-veggie, you only have consumed 360 kilocalories. And apart from that, you have taken a good quality food which is full of vitamins, micronutrients, and supplements which are going to prevent a lot of disease in your body. So the Food and Medicines Organizations likely to be of interest by fibers found on the list of the food with other important materials such as calories, and based on the scientific evidence that prove that 4 things related to fiber reduces the risk of heart disease and cancer. Psyllium seeds itself is a full fiber, and it is very lightweight, and it can produce 150,000 gelatin capsules can be made from psyllium fibers, and it can produce not only derivatives which can give a control on the dietary supplements, but also to take care of the integrity of the intestinal tract itself. When the fiber mixes with the water, which is the quality of gelatin is to absorb water, and it stimulates the transfer of the materials which are waste and not to be supposed to be absorbed into the body, and they are drained out because of these psyllium fibers out of the body. So the numerous studies are there, and there's a strong relationship of high fiber and prevention or even the colonic cancer. As a treatment, psyllium itself has been used since ages for constipation, for diarrhea, for any sort of intestinal disorder, for high cholesterol, low density cholesterol levels are high, so people use it as a food. In diabetes, they say it takes care of the diabetic control over the diet, obesity, hypertension, heart disease and colon cancer. But it has to have a high content of water with it. Also, it has some good hormone which is definitely active for reproductive health. If you take celery, celery itself has got a lot of known uses. Apart from myco-veg, people have been using it as a treatment for urinary tract and joint diseases in the past, and for rheumatoid arthritis and nervous exhaustion. And the benefit to circulatory system for mulberry leaves has already been documented all over the literature. If you take raspberry juice, it helps in urinary infections and also for circulatory systems. So mulberry leaf itself has been used in lots of upper respiratory tract conditions by the Ayurvedics and the alternative medicine practitioners to reduce asthma and to prevent oxidation of bad cholesterol. And thus it protects the body to the injury to the arteries. It also keeps the heart healthy. It is used as an act of antibacterial action in urinary content, and definitely for other diseases like ulcers, anti-aging, it has a good content of antioxidants. Ginkgo biloba, nowadays very famous in nutraceutical industry as an immune modulator, plus it has benefits for memory enhancer. So not only students, old age people can benefit by taking ginkgo biloba products. So we have it as a part of our myco-veg in it. It's a treatment of Alzheimer's and as an anti-vertigo agent. Ginger, a very well known part of our day-to-day food. Why it was taken? Basically, somebody who has introduced it to our nutritional additions of the food content, because it is very good for the vomiting for pregnant women. And stomach disturbances, headaches, flu, inflammation of any kind, people used to give ginger in tea and ginger in coffee and in diet. Normally they sprinkle cut fibers of ginger on a diet which they think should be heavy, And it not only detoxicates, but it also reduces the joint pain and inflammation, also reducing weight. Lemongrass, which is very good for nervousness and stress. Mushrooms, like all our gano mushrooms or shiitake mushrooms from the same community, it has anti-cancerous and immunomodulator effect. It antiviral, anti-allergic, and also anti-arthritis again. Lime, everybody knows about lime and lemon. What is the benefit of vitamin C and what is the benefit of vitamins in oranges? I should not stress more. Everybody knows that how much micronutrients as a part of your cell, they are responsible for your health and life of a cell. Green tea, very famous in a dietitians or in obesity group, that they don't want to do dieting, they just take green tea after every meal, because it controls and regulates body temperatures and blood sugar, and it promotes digestion. Also, it is very good for healing. It has been said that it also controls some of the bleeding tendencies. Green tea also it has a very good effect on addicts, people who are addicted of alcohol or smoking. They use it to undo the effect of alcohol.